Hi, and welcome to the oral health module of this initiative, Healthy Food and Oral Health. My name is Caroline. I am a dental hygiene therapist and also a nutritional therapist. And my passion and my drive is to educate people on the links with poor oral hygiene and the links with systemic diseases and how we can positively improve our oral health using diet and lifestyle. In this presentation, I'm going to talk about the mouth and the digestive system. We're going to talk about dental decay. We're going to talk about gum disease. We're going to talk about the links between diabetes and oral health, and also the links between other systemic diseases and oral bacteria. Finally, we're going to talk about preventative little nuggets of information that you can use yourself, but also share with the people that you work with. So when we think about the mouth and the digestive system, it is the beginning of the digestive system. We have, from a mechanical perspective, we have our teeth. They chew and crush our food. We have the tongue, which is there to taste and to help with swallowing. We have the muscles, the surrounding muscles that help us chew our food. Our lips help to keep the food in our mouth while we're chewing. And then we've actually got sensory receptors to judge the temperature and the texture of foods as well. From a chemical perspective, we have the saliva, which helps to lubricate the food while we're chewing it. But it also has an abundance of neutralizing aids, and it helps us chemically break down the foods that we eat because it has digestive enzymes. It's really important to note that to get the best out of your digestion, we want to be able to chew and breathe at the same time. When we smell food, this is a pre-digestive state, because as we smell the food, it actually helps the body prepare for digestion. So smelling is really important. When we think about dental diseases, dental decay is the most common non-contagious disease in the world. So basically what happens is free sugars are the essential dietary factor in the development of decay. Now, free sugars are found in sweets and crisps and pop, but also free sugars can actually be found in fruit juices, because when we squeeze a natural fruit, we lose the fiber content and we're just left with the free sugars. Yes, it has vitamins and minerals in it. So a small glass of fruit juice with your breakfast is brilliant. But if we're snacking or drinking fruit juice in between meals, this actually increases our risk of dental decay. Dental decay is the primary reason for hospitalisation of children in the UK. So if we can support our clients with these little nuggets of information and support the use of drinking water rather fruit juice instead of fruit juices in between meals, this really, really reduces the risk of dental decay. This is the decay process in a nutshell. So you have oral bacteria in your mouth. If we feed those bacteria with refined sugars, then the bacteria produce an acid. It starts to demineralize the tooth. So if we leave the acid on the tooth, over time, it starts to dissolve the tooth. If we allow the saliva to bring everything back into balance, it takes about half an hour. If we're then snacking on more food, we create more acid. So the key is to try not to snack if possible. So it allows your body to neutralize the acids to reduce your risk of decay. When the part of the tooth, the enamel breaks down because of the acid, then the bugs can get in the middle part of the tooth. If the bugs get into the very, very middle part of the tooth where the nerve is, this is when we feel pain. And this is sometimes we can need a fill-in, sometimes we need the root removed, or a root canal, or sometimes the tooth might need to be extracted. So early intervention is really key. Supporting the people that you work with to really seek out some dental support and screening, and just educating them on sugar intake, but also frequency of sugar intake as well. The second most common oral disease is gum disease. And nearly 50% of adults over 30 have some form of gum disease. And actually that can go quite unnoticed unless it's been screened in a positive way. So we might see people with who complain of bleeding gums. Bleeding is the first sign of gum disease. So if you have people you are working with who have bleeding gums, guide them to a dental professional. Explain to them that the bugs in the mouth are causing that inflammatory response. So it's super important that they're brushing their teeth, even if the gums are bleeding, to try and remove that bacterial source. Vitamin C is a really potent anti-inflammatory. So brightly coloured fruits and vegetables have an abundance of vitamin C. So trying to increase dietary vitamin C can support in reducing inflammation in the mouth. Certain family history or stress or poor sugar control and smoking have all been researched and have been shown to increase the severity of gum disease. Bacteria involved in gum disease has been linked with other diseases like Alzheimer's, heart disease, and even rheumatoid arthritis, which is an autoimmune disease. This is the basic process of gum disease. So, oral bacteria stick to your teeth to create a sticky plaque. We call it a biofilm. This biofilm sticks to teeth and also gets underneath the gums. Where the gum meets the tooth, that little bit of area is not actually attached. So we create a little reservoir underneath the gums. So you can imagine if that bacteria is left on the teeth, we are fueling those bacteria with sugars, and we are not brushing that bacteria away, then your immune system will want to protect you. And your immune system is found in your blood. And this is why our gums bleed. Your body is trying to protect you from the bugs and bacteria that are sticking to your teeth. If there is unresolved bleeding or unresolved inflammation, and you have a stressful environment, or you are not eating foods with nutrients in them, especially vitamin C, you are stressed, or you've had a poor sleep, or you are increasing your risk factors, then that inflammation potentially might start to affect the surrounding tissues of the tooth. That is the bone and the little ligaments that connect your tooth to the bone. This will lead to bone loss, might be seen as recession, and potentially you might lose the teeth. But progressive gum disease can't happen if there's no inflammation. So we want to reduce our inflammation. So anti-inflammatory diets, working on our stress management, reducing our alcohol intake, and trying to stop smoking, managing our blood sugars will all help to reduce the inflammation. Diabetes and gum disease is highly researched, and the research shows that people with diabetes have a greater risk of gum disease. But also, gum disease can negatively affect diabetes control. So that means it has a bidirectional link. Therefore, successful gum treatment may improve your control of diabetes. And good control of your diabetes will support the gum healing. So we want to look out for bleeding gums, receding gums, bad breath, wobbly teeth. So these are the kind of things that the people that you're supporting might be complaining of. So really try to guide them to see a dentist or a dental hygienist so that they can get that support. Heart disease and gum disease is also another really an area that has been researched, because the bacteria involved in gum disease can actually enter the body where the gums are inflamed and slightly ulcerated. So these bacteria get into the system, they cause inflammation to the blood vessels, then they become they lose their elasticity, and the blood flow can then stop flowing effectively through the blood vessels, and it can increase your risk of a heart attack. So again, bleeding gums, guide the people that you're supporting to the right people for good oral hygiene support, and then encouraging an anti-inflammatory diet and lifestyle to reduce their inflammation and reduce the risk of those bugs getting into their systemic system. So, prevention. It really doesn't have to be difficult. We don't have to overthink it. There are some really, really simple things that you can suggest. First one is brush your teeth. Ideally, you want to brush your teeth twice a day. The most important time to brush your teeth is before you go to bed. Why, you may ask? Well, you've been eating food during the day, those bacteria have replicated and they're sticking underneath your gums and in between your teeth. And that saliva that we talked about, that neutralizes everything. We don't actually produce much saliva at night. So those bugs can cause more damage if they're left on our teeth before we go to bed. So simply suggest that people are brushing their teeth before they go to bed. Encouraging the people that you're working with to brush their gums as well. So getting the toothbrush underneath their gums, because we know that the bugs sit underneath the gums and in between the teeth. And if they do see bleeding, just, educate and say bleeding is caused by the bacteria. If we remove the bacteria with the brushing and improve our anti-inflammatory diet and lifestyle, that will support the reduction in the bleeding. But if they do have bleeding gums and they are concerned, please guide them to a dental professional who will support with the cleaning, but also very personalized educational information on how to brush correctly. Eating a balanced diet. So we've talked about anti-inflammatory diets throughout this session, which the other guys will talk about more in depth in the other modules, but it really, really doesn't take much to really reduce the inflammatory load. So if you can, 3 main meals a day, less snacking, making sure that plate is balanced with fresh fruits and vegetables, good quality protein and healthy fats, and reducing refined carbohydrates, refined sugars as much as possible. Simply drinking water in between meals instead of fruit juices can really support the body because it's an anti-inflammatory environment. Chew your food effectively. So when we chew our food, it just helps our digestive system. When we're not chewing our food, we might feel a little bit gassy, So trying to chew and swallow at the same time. Breathing through our nose so we can start the digestive process off, smelling our foods, getting in the kitchen. That can be such a simple way of supporting our digestive system as well. Managing stress, because when we are stressed, it really stops our digestive system from working, and we need those nutrients to actually heal. Sleep quality is another good one, because sleep's when we heal. So if we're not sleeping properly, then it upsets the internal environment and can drive inflammation. Smoking and getting some support to stop smoking. Smoking actually, smokers burn through 30% more vitamin C than a non-smoker. So if the people that you're working with are not ready to give up smoking, really encourage them to increase their vegetable intake so that they can reduce their risk of the gum disease. Also getting screened by the GP to rule out any blood sugar imbalance, especially if the people that you're working with are struggling with wobbly teeth or if their teeth have fallen out, and hopefully allowing the GP and the dentist to work alongside each other to help from all aspects. If you're interested, there are some amazing patient educational videos on the BSP website. So I've put a link here. I'll not put the videos on there, but if you take a picture of that or get the links to this, there's some amazing little videos on there, to educate yourself, or you can share them with the people that you work with. There's also an amazing Delivering Better Oral Health toolkit from gov.uk, which might also help to educate you if it's something that you're interested in. Thank you so much for listening, and I hope this was educational, and I hope you've taken some nuggets of information away. I'm very passionate about sharing this information, so my Instagram handle is at the Functional Hygienist, and please reach out if you need any extra support. Thank you.